The next presentation you're about to see is with Dr. Heidi Peterson. She is a naturopathic physician. She's a specialist in natural medicine. And Dr. Seebecker, tell us exactly what she's going to be talking about.
She has two topics she's focusing on today: electrical stimulation, e-stim machines for SIBO. And she's going to talk about how she is using them in her SIBO patients in place of prokinetics. So this is absolutely mind blowing, right? These are like, those sort of physical therapy type machines. So she'll talk about that. She's also going to talk about she uses neural therapy. Now we have Dr. Ann Hill and Dr. Ilana Gurovich both talking about that. She uses it in combination with myofascial release for many of her patients, and she's going to describe that as well. I have to tell you, I was just thrilled to be able to have Dr. Peterson speak because she rarely says yes to teaching opportunities. She is just a devoted clinician. She is revered in our naturopathic community. She's been in practice a very long time. She's just devoted to her patients, helping them get better. She sees challenging cases.
So here's a picture of a low volt alternating current sine wave machine. It is a biphasic current is produced with low voltage and amperage, and you can do it in many fashions. You can do it in a constant, surging, or pulsed fashion. So how does it work? It works in lots of different ways. It depolarizes sensory and motor nerves. There's musculoskeletal re-education, pain control, and reduces edema. And it's certainly been studied to do re-education of large bowel peristaltic rhythm. Now, this research was done over 50 years ago, so we certainly don't necessarily know that it'll work for the small bowel. But when I was struggling with some of my patients, I thought, well, if this works for the large bowel, then it likely would work for the small bowel as well. It works by spinal reflex stimulation, so it stimulates the nerves as they enter the spine, and then through reflex stimulates the nerves in the intestines. It also promotes enhanced tissue perfusion, increased lymphatic circulation, and improved venous return of the blood. So what are the indications classically for it? Constipation, which clearly we know in SIBO is a huge problem. And